The knee exam, the first thing we look at is the appearance of the knee. We're looking today at the right knee. Is there evidence of recent trauma like an abrasion or contusion? Is there obvious swelling comparing one knee to the contralateral knee? Is there excess amount of varus or valgus? We note here that the patient has full extension of his knee, and we can test to see if he has fluid by milking the suprapatellar pouch, milking the fluid down and seeing if we can ballot the patella or if we can create a fluid wave. We want to then see if he has quad control. Can you lift your leg up straight, John? So he has control of his quad, and then flex your knee up and down a couple times. So he has full flexion, and I'm also feeling to see if he has crepitus under the patella. Now we're going to examine the ligaments. I like to put the ligaments all together. So the medial and lateral collateral ligaments and the posterior and anterior cruciate ligaments, I examine them as a group with separate exams. So the first is the collateral ligaments. My left hand is the fulcrum. I examine the knee in full extension. Valgus stress tests the medial collateral ligament and the varus stress tests the lateral collateral ligament. And since the posterior capsule stabilizes the knee in full extension, to relax it, I flex the knee a little bit, and then again I test the medial collateral ligament and the lateral collateral ligament, and I'm interested in how much excursion there is, and again the contralateral knee can be a control, and I'm interested also in the endpoint. Does it come to a firm endpoint, or is it kind of mushy? And then for the cruciate ligaments, I want to test the drawer test, so I stabilize the foot. Some people sit on the foot. And I want to have my fingers underneath the hamstrings to make sure they're nice and relaxed. And then I gently pull forward and back again. What kind of an excursion is there and what kind of an endpoint? And a better test to eliminate the hamstrings is called Lachman's test. The knee is almost fully extended. The hamstrings are now neutralized. I put my thumbs on top and I see what kind of excursion the proximal tibia makes compared with the distal femur. Again, how far does it go? What kind of an endpoint does it have? Anterior and posterior. And those are the ligaments. Now I want to examine the menisci. I want to palpate along the lateral joint line and along the medial joint line. And I'm watching the patient to see if he's reacting, if he's having tenderness here. And then I'll do McMurray's test. I put my fingers on the joint lines. My other hand is at the ankle. And I'm flexing and extending the knee. I'm rotating it internally and externally. And I'm doing a varus and valgus stress, trying to catch a piece of the meniscus between the bones. And I'm watching his face, seeing if I'm eliciting any pain or pops under my fingers. Apley's test is the same as that test, only the patient is prone. I feel posteriorly, is there a popliteal cyst? And then I want to go and look at the patella. Examination of the patella, we want to see if there's tenderness medially or laterally about the patella. We want to do an apprehension test where we push the patella laterally. Most patellas will go about half of their diameter, but you can compare it to the contralateral control. And does this lateral pressure reproduce his symptoms to suggest instability, subluxation, or a tracking problem? And the other test for the patella is a grind test where you push straight down and see if that reproduces pain because of irritation underneath the patella.